Okay, so this is closing an encounter. Okay, so today we kind of talked about a lot. So we have a couple minutes left, and I just wanted to kind of make sure we're on the same page. So the good news is your blood pressure's doing really great, your heart sounds great, and I know we've had some problems with that in the past. The things that are worrying me a little bit are the cough that has a little bit of blood in it. You're kind of fatigued, looking kind of pale to me, hearing some consolidation in that right lobe. So I feel like it needs more investigation, and I'd kind of like to do some more things, including blood work, a CT of your chest to look for things like lung cancer and possibly tuberculosis, which is, not super common, but could be a potential, kind of just to make sure that we have every one of our bases covered. So kind of what do you understand about these things I'm telling you about lung cancer and tuberculosis?
Well, I've smoked for a very long time.
Okay, right. And, it's kind of more about what we're doing in the future now. So this would probably maybe be a good time to kind of quit or kind of like lower the amount that we smoke, because it can lead to lung cancer, but it's good that you acknowledge that. What about tuberculosis? Do you have any questions about that?
I'm not sure what that is.
Okay, so tuberculosis is a respiratory illness, and it can kind of present with the fatigue, the pallor, and the blood and the cough is what's kind of getting me riled up about tuberculosis. So that's why I also want to do a TB skin test, see if you react towards it, and see if we need to put you on treatment for it. That treatment is going to be really long, but we'll kind of worry about that when we get there, if that's okay with you.
Mm-hmm.
Okay. So what do you understand about where we go from here?
Well, I have more tests that I have to take.
Right. Okay. Mm-hmm. And like we're going to get blood work. We're going to get a CT of your chest. We're going to do a TB skin test. We're going to do everything we can to kind of make sure we cover all of our bases.
Okay.
Okay. And then there's really not too many options. Are you okay with all of those decisions, or would you like to not pursue any of those avenues?
No, that's fine.
Okay. All right, well, that sounds good. So, like I said before, everything's doing well with your blood pressure. Your heart's doing great. It's just kind of these respiratory things. It could be something as easy as COPD. Could be just a bronchitis as well. It doesn't necessarily means that you have lung cancer. I just really want to make sure that we go through everything, just so nothing is gonna, hurt you in the end. So we'll do that. We'll get the CBC. We'll get we'll do the blood work. We'll get the CT of your chest. We'll do the TB skin test and kind of go from there. Okay.
Okay. Yep.
All right. Sounds good.